So now going to this, something of my experience, the concept of therapeutic shortcut practice. I have attended cardiac emergencies, neurological emergencies, regular what you call convulsions, high grade fevers. Like I just gave an example. This is what I already mentioned also here, that this was the case today. Yesterday I saw this case. Yesterday at 4 o'clock, the child came to my hospital, had a fever, 104.6 degree temperature, acute bronchitis with typhoid fever. The remedy which I gave was aconite, 1 m. Till around 4:30, the patient received aconite 1 m. Till 11 o'clock in my hospital, the child was very happy. He was much better. He asked for food, he was better. And today at 4 o'clock, he's discharged. 6 o'clock, sorry. He's discharged. What worked? Aconite 1 m. What I did? Nothing new. Everything is mentioned in the Organon, which I'm sharing it out with you. Okay. So now these do's and don'ts of therapeutic practice for acute and chronic diseases. So chronic part, therapeutic prescribing in chronic is very easy. And therapeutic prescribing in acute is even more easy, because everything is fresh in the memory of the patient. You get a lot of information, part. It will work like magic. And homeopathy, when it works like magic. And when there is magic, there is no logic. So this, I have found some points of my experience which I'm sharing it out with you. I may differ to you, but this is what my observation, and this is completely from my experience to you, so that this will really help you in a way to manage therapeutic prescribing for acute as well as chronic cases. You can go very fast whenever you have clear diagnosis. Suppose the patient has asthma, acute asthma, you have clear diagnosis. The patient has tonsillitis, clear diagnosis, bronchitis, pneumonia, whatever, clear diagnosis. From the disease to the symptom to the medicine, you can go. But when there is no diagnosis, no clear diagnosis available, when the clear diagnosis is unavailable, either for acute or chronic, anything I'm talking about, when it is not available. It's like example, I'm telling you a case of a physician. Yesterday I saw in the evening. The case is of anal itching. That doctor had a starting of anal itching. He first treated himself with some applications and etc. Did work out. Then he consulted his surgeon friend. Surgeon made proctoscopy and he said that you may be developing piles, or you may be developing fissure. Then you should take his anti-worming treatment, anti-worming treatment. So he took it, didn't help him at all. Then he said you may be developing piles or fissure, so you should do this type of treatment. It didn't work out. He applied steroid, he applied antifungal, he applied local topical ointments, and etc. whatnot. Then the surgeon says, probably I think it's not my subject, you go and meet dermatologist. So physician went to meet dermatologist. That, sir, what is this problem? You please tell me, evaluate. He said you have proctitis. You have proctitis. He said, okay. Then he took the treatment of proctitis. That is rectum inflammation. He said, but I don't have pain. I don't have fever. I don't have signs of inflammation. I only have itching. Then he was being treated with for proctitis. No solution at all. Then again physician went to that dermatologist. Then he said, probably you have allergy. You take cetirizine. So then he started taking cetirizine, Atrax. He was better partially, but not up to better. What happened is that the only itching which was there at the anus, the anal part, anal region became dry, became very raw, and as a result, patient is much more worse than what he was at the beginning of the problem. And then, you know, when everything falls apart, people remember for homeopathy. And I took that case yesterday. And the case is of classic phosphorus. Classic phosphorus. I given phosphorus 30 potency. I'm very sure that the medicine will work. But if you see phosphorus, this anal canal pathology, phosphorus has nothing to play for, has very limited role to play. So therapeutic modality, don'ts of therapeutic practice is not advisable when the diagnosis is not clear. When the diagnosis is clear, go ahead. That is first point. Second point, single disease. You have single disease to hit. But just now I discussed about bronchitis with high grade fever, with typhoid fever, and I gave aconite. But if you see aconite, it is mentioned in bronchitis, but people don't know how to use aconite. Maybe one of the most neglected drug in Mater Medica, quite possible. But when you're single disease, you can go for therapeutic prescribing. But when you're multiple diseases, you have to go for standard homeopathy practice. That is strong for constitutional prescribing, fundamental based prescribing. Third is acute disease will need courage and confidence on the part of homeopath. And this courage and confidence will always come if you are clear with the theory. If you are not clear with the theory, how to take a case, how to give the medicine, what to expect after giving the medicine, if there is a success, what to do, if there is a failure, what to do, how to manage the patient apart from medication. This is all the things. If you know, probably you can be a best prescriber. Best prescriber. There is a Kant used to be a fantastic prescriber, right? This is the topic which I have taken it out today, so that you will be able to understand how to have, confidence and courage in order to manage an acute or even chronic therapeutically, right? Then acute exacerbation of chronic disease. Right now it's a scenario of monsoon. Here acute aggravation of chronic asthma, acute exacerbation of chronic asthma. Typical environment, respiratory allergies, change of weather producing problems, lot of things. Here therapeutic prescribing will work, because whether you are aware, if you are able to find some good PQRS, you are clear with diagnosis, you can go ahead. But otherwise, don't take chance. Go for constitutional care, proper deep evaluation. Otherwise, what will happen? You will be in a big problem. Big problem. Then medically known old diseases. No, we have diagnosis. If you see in the repertory, tonsillitis, we have certain remedies. Pharyngitis, we have certain remedies. Bronchitis, we have certain remedies. Pneumonia, we have certain remedies. Whatever, we have certain. But there is no remedy mentioned under the rubric COVID-19, because it was not known. Right now, people are coming up with mobile syndrome. The new disease which is now coming up is mobile syndrome. Right? People are coming up with porn addiction. There is no disease like that which is mentioned in the repertory. So therapeutic prescribing has a risk. So you have to be clear whether this disease, what you are heading up to, is a documented fact in the repertory or in the source book or in the literature or not. If it is documented, you can take that as a reference. If it is documented, medically known old diseases, if it is documented, go ahead, no problem. You will not get a failure. If you get a failure, all the people, stalwarts will come to help you. But to treat COVID is a big problem, because nothing is mentioned in the literature. In this multiple waves of COVID, I have treated more than, I would say, 4,700 patients. More than 4,700 patients I have treated total, with a great success, because of Organon. Because this is nothing new. It is just a set of symptoms. Disease is a set of symptoms. Whatever name they give, it's not important for us. It is 81st, 82nd aphorism. What we have to understand is to find genus epidemicus, or to find out the proper remedy according to the constitutional modality, and then go for it. So this is, if you suppose the patient is coming to you and you are examining and the throat is clear, it's a tonsillitis, go ahead. But if you are not sure that the patient, what disease patient is, you are not sure, don't go for therapeutic prescribing. This is a big risk. I have made many mistakes in my life to give Simply, suppose the patient has fever, high grade fever. Then I've taken a fever, intense heat, or high grade fever, etc., etc. And then I have selected the medicine and I've given it out. Will end up into disaster. मैं उल्टे मुंह के मतलब सिर के बल गिरा हूं, क्योंकि वो कॉमन सिम्टम है. That is common symptom. So if you are not clear about what is common, what is uncommon, and that common and uncommon only can come to know if you are clear with the diagnosis. Because without diagnosis, you cannot differentiate what is common and what is uncommon for individual. So this is very important. If you are clear with the diagnosis, go ahead. But if you are not clear with the diagnosis, or if you are dealing with new pathology, say for example, one of the case I am going to show it to you is Fukuyama. Fukuyama is a Japanese muscular dystrophy. It is very rare condition in India. It is something which is very, one of the case I'm going to use is pyrexia of unknown origin, gross pathology, pyrexia of unknown origin. So our repertoire has very limited understanding about this disease. So when you're not clear with the diagnosis, therapeutic aspect, take care. Please take a hold. Go for constitutional proper. But if you're clear with the diagnosis, go ahead. Then life-threatening emergencies where there is no time and no chance. I recently had a case in Zydus Hospital where I visit as a consultant. It's one of the metro hospital. The patient has head injury. He has concussion in the brain, confirmed with MRI, and the person was on ventilator, and he was really on a very bad situation. And usually the head injury gets worsened after 24 to 48 hours because the blood is getting clotted. It will produce brain compression syndrome and whatnot, right? I was being called, and what I did, I gave arnica. I worked out the case. It was sore limb, bruise feeling. Patient was tossing, patient was not clear about, the typical arnica picture. I gave arnica 1 potency. Within 24 hours, the neurophysician, who is also a good friend of mine, he said, I don't know, but this patient is not developing that frequency of blood clotting in his brain, which you should have developed as per my experience. I said, thank you. I wanted to hear this. Repeat arnica. After 48 hours, the condition was improved rather than it should have worsened. So life-threatening conditions where amyl nitrosum for angina, I'm not here to go to Matra Medica here, to be honest with you, because my topic is Organon. But something which is you need to understand very important is therapeutic aspect, where a person is dying with heart attack and you cannot go and ask, do you like sweets? Because I'm thinking lycopodium in you. No, very bad homeopathy. That is not the thing. When the life-threatening emergencies are there, go at it. Just go at it. Their therapeutic role plays a big role, big benefit, right? Strong allopathic knowledge is a must. I appreciate the knowledge of Dr. Farooq Master. I appreciate the knowledge of Dr. Sunil Sarkar. Super knowledge. R.P. Patel sir, one of my teacher, great knowledge of allopathic science. Super. They are like just touching the patient and they are coming up with the remedy. So powerful they are. Strong allopathic knowledge. So more you are clear, because in order to treat a disease, you need to know you need to differentiate what is common and uncommon, what is individual and what is common. That you can only come to know when the person when a homeopath has a strong allopathic knowledge. It is something which is very, very, very important. I have so many cases in my reference that because of my understanding of allopathy, because I have been trained for almost throughout my BHMS tenure in my bachelor with multiple physicians, surgeons, because my father is a doctor, and I used to sit with a lot of allopathic consultants for understanding. So strong allopathic knowledge is an absolute must if you want to manage cases therapeutically. If you go for chronic constitutional care, you can refer the patient, you can get the diagnosis done, etc., etc. That's different thing, right? All the time it's not possible. This is very bad. This is the real truth of today. Both the things are not all the time possible. Chronic constitutional homeopathic prescribing, the way what we go for, thorough case taking and then coming to a prescription, and going for therapeutic care all the time, not possible. Homeopath can only become successful if he has a flavor of both, if he has a blend of both. All the time, only therapeutic prescribing will end up into vain. See, Kolkata. Kolkata used to be blossomed in the late 90s or uh, in the last decade of the century or up till 2010, I believe. But then after it is going down because all the prescriptions have been given by Fatak, Borik, and Allen. There are very few homeopaths now who are shining success, but they all have understood fundamentals very well, and then they are practicing. Otherwise, you see 200 patients a day, you see 100 patients a day, and to prescribe everyone therapeutic, it's not possible. And to take one patient a day and to make the whole constitutional homeopathic care for all the patients you see, that is also not possible. So you need to have a blend of both. When you need therapeutic, you should go for therapeutic. Like this example, the first case. My yesterday's case was having this is therapeutic prescription, where this was more or less a constitutional homeopathic prescribing. So you need to have a blend of both. Otherwise, you will be in big problem, right? Clinical examination is a must. I mean, clinical examination is an absolute must. This pharyngitis and tonsillitis. People say both are what you call Gujarat. In Gujarati, it's called kakra. I don't know what is being told in your local language, but people say he has tonsillitis. But it can be pharyngitis also. Both are the part of tonsil. So ultimately, if you see in repertory, your pharyngitis, recurrent pharyngitis, you have different remedy. And if you have recurrent tonsillitis, you have different remedy. So clinical examination is an absolute must. Especially pulse and this disassociation of pyrogenum, pulse to fever, or throbbing pain synchronizing with the heartbeat in the head. This is belladonna. This is all very, very commonly seen with a clinical examination. 1 foot hot, 1 foot cold lycopodium, head hot, body cold, belladonna. This is all very clinically possible when you examine. Yesterday's case, I was thinking about belladonna because it was having sudden onset, very clear picture of belladonna, but his head and palms and limbs were very much equal in degree of what you call temperature distribution. So I turned out with aconite. See the success. Recent example. So this is how clinical examination is a very must. Friends, before going further, can I have your feedback quickly? I hope I'll be able to get some. I hope I am of some help to you. Please share your feedback very quickly so that मुझे पता चलेगा कि भाई आपको समझ में आ रहा है नहीं आ रहा है क्या प्रॉब्लम हो रहा है. It is pure clinical. This is every homeopath has its own organon. Every homeopath has his own organon, and that is very true because ultimately the patient what we see is individual. Nothing is what you call common. Everything is unique in this universe. So more or less, it's every individual has its own organon. But more or less, that's what Hahnemann has said in 83 aphorism. General direction. He has not given specific direction. He has given general directions because of this reason only, right? Okay, thank you, Dr. Shreya. Thank you, Dr. Bansi. Thank you, Dr. Navneet. Thank you, Dr. Shraddha. Yes, thank you, Dr. Shraddha. Thank you, Dr. Shreya. Yes, thank you. Thank you, Dr. Bisma Afreen. Great. I'm happy that you are liking it out because this is pure clinical, and I believe organon should not be read. It should be lived. It should be lived in practice. Organon itself is written as an experience on patients. So the best way to learn organon is also from on patients, right? Now going to the next. This is again very, very important, and annotations on from disease to simillimum. But provided you have the knowledge about the disease in the repertory, you also know about the disease and you can reach to the simillimum. It's not possible. Those from patient to disease to simillimum is a big problem. It is definitely not an advisable fact because in therapeutic, this is not the approach how we go for it. Best for palliative care. I see a lot of cancer patients, third stage cancer, fourth stage cancer, cancer with the prediction of 4 months survival, or a people who do not want to go for chemotherapy. They are reluctant to go for chemotherapy or radiotherapy. They say, I will prefer to die early than getting suffered and being handicapped and to become burden of my family. You know, people are having, AIDS with CD4, CD8 count very bad, very, very bad. I see this type of patients. Here, many times therapeutic works like magic. Multiple spread of cancer, carbo animalis, cadmium, sulfur, super medicines. So best for palliative care is to go for therapeutic, because you do not touch the vital force at a very deep level. Otherwise, it will produce killer aggravation. That is aphorism number, that is observation first from Hahnemann. It will produce killer aggravation. So that is also not a good way. Injuries from external cause, 187, 188 aphorism. Suppose you are going downstairs and you had a fall and you have an injury on the ankle, or you had a fall and you have bruise on your ankle or a fracture on the ankle. How far it is logical to take the remedy from mouth where the rest of the body did not participated in formation of the disease? Think about it. 87, 88, 187, 188 talks about this only. The rest of the body did not participate in development of the disease. This disease because of external force. So are you supposed to take internally or locally? Arnica ointment, arnica liniment, sometimes there are some other external applications are available which has a role to play. In order to give the arnica, you have to have the state of arnica with symptoms of arnica. Because you are not covering the symptoms, you are covering the state having the symptoms. So in this therapeutic practice, injuries from external cause has a great role to play. Like this patient has a concussion in the brain, right? What I was able to get from the history was his typical delirium. That's all, and I gave arnica, helped the patient very well before he went into in a very bad state. So this injury from external cause, injury from external cause. So that is therapeutic modality. But the same patient ends up into complication, that the injury on the feet gets inflamed. Person has fever. Person has genuine whole body is becoming sick now. WBC count is increasing. There is an infection, secondary infection. There you are not supposed to go for therapeutic treatment. There you have to go for proper standard homeopathic treatment. Otherwise, it's not possible. So I see people having, a very bad cellulitis with high grade fever, giving Rustox or giving whatever drug simply just to control the cellulitis. It's not possible. Now the whole disease has participated in that acute phase. So you need to go for standard homeopathic practice. Here, therapeutic practice will not play a role. There is no logic. Here it is an absolute logic. This is of best use. But people mix the two. So suppose I have a patient, has an injury, and patient is not whole body is not sick. I would rather prefer to go for external application. Say for example, calendula ointment or arnica ointment or whatever. But if I want to treat the patient internally, I have to take the case with acute state, right? Because mind will be deranged for sure. Here you have to take the full case. Otherwise, you will end up into complication. There is no doubt about it. Can be clubbed with allopathic care in allopathic hospital. Can be clubbed. You can, there are ICU patients, kidney failure, what you call multi-organ failures. I'm treating patients in multi-hospitals. I have my own hospital also. A lot of allopathy doctors are visiting my hospital just to examine the patients whom I have admitted. So when a patient is multi-organ failure, you are not supposed to go very deep. Otherwise, what will happen is that killer aggravation can come up. So I go with LM potency, I go with 6 potency, I go very low, very slow. Because ultimately, these allopathic drugs should not conflict with the homeopathic drug. Otherwise, patient will become sandwich of the situation. And he will be in the flight to the next world. That cannot be made. So you are supposed to be very, very critical, go low and slow. Once you are able to find signs, once you're able to find the sign of similarium in the body, then you have a way to go ahead freely. But at that, till then, you have to go low and slow therapeutically, clubbing with allopathic care. Here, I mean, it's completely, I really don't feel that don'ts of the chronic disease, whom patients are already into allopathic medication, you have a problem. Chronic disease, therapeutically, no problem. So this is something completely different. Now, this is very important. This will most probably work as superficial care. Of course, it is not all the time. Sometime it can work as a deep cure as well. There are conditions. If you read Dr. Jhar's 40 years of practice, G.H.G. Jhar's 40 years of practice. If you read that book, you will come to know what I'm talking about. Because Hahnemann, if you see his entire Organon, has appreciated only two homeopaths in his own Organon, is Dr. Jhar and Dr. Bonigusen. And Jhar was one of the greatest, finest student of Hahnemann, and one of the greatest prescriber after Hahnemann. So that is something accordingly for that. It will most probably work as superficial care. Ignoring thorough re-evaluation after settling the present complaint is a big mistake. Once the acute is settled, it is applicable for here also. It is applicable for here also. Once the acute is settled, your remedy is worked, you are settled in acute, you have to take the deep case. Otherwise, there is a possibility of relapse. Which level the miasmatic activities are going on, you never know. So it is always advisable to take the case of the patient post settlement of acute. This is very needed, right? Next, you will become famous overnight, especially among allopathic practitioners. That is my situation. When I started my homeopathy practice, I had almost 20 square feet of clinic, and I used to see 4 or 5 patients a day maximum. Right now, I have 2100 square feet of hospital with indoor patient facility. Lot of doctors are working under me, and my neighbor is a physician. My the what you call next floor is of physician, gynec. The lower floor is psychiatrist, dentist, and general practitioner. In the road where I practice, or the way where the road where I live, is something which is the most lucrative place of the town, and I'm surrounded with 99% allopathy doctors. I am the only homeopath sitting amongst them, practicing successfully, simply because following the fundamentals. My acute management, this patient, what I'm talking about, what I have treated yesterday in the after evening, discharged today, if it would have been admitted in the hospital, just ab ek bar sochiye, typhoid fever, 104.6 degree temperature, with acute bronchitis. If the patient is getting admitted to allopathic hospital, what will be the bill? Almost 40,000, 35 to 40,000. The patient was not affording. And how much I have charged? 1,200, 1,500. But these ways make you famous overnight. I mean, wow, there is a wow feeling. Case got sorted out overnight. So acute will give you a name and fame overnight, but it's up to you how you manage it afterwards. Otherwise, success, you can get it in parts, but if you want to get a constant success, you have to be grounded on the fundamentals. That is true, right? So this, you will become famous overnight. So if you are able to, I frankly tell that this therapeutic prescribing is not that good for beginners, because they are beginners. The best way is to go to them for proper constitutional evaluation, and then making probably the same remedy may come up what they would have come through therapeutic angle, but still the confidence level or the management part of the case will become completely different. So this is the truth. Next is, you will lose the patient forever if you fail to treat. This is my experience. In my early years of life, I was not able to treat acute successfully, and eventually patient used to change the doctor. Before I change the remedy, they change the doctor. And this is a bitter experience of my life. And learning from my failures every day has made me to realize what I am today. And I'm still learning. I'm every day reading at least 2 to 3 aphorisms every day. My reading never ends. And as I said, I would love to die as a student. So this learning every day has made me what I'm today, and that's what I'm sharing it out with you. That please, if you are, first of all, if you are able to take the acute, you take it. If you take it, then commit yourself 100%, because acute will take your blood, sweat, and tears. Of course, it's highly rewarding job if you get a success, but it will take a price from you. And at the same time, if you fail, be clear that you are not going to see this patient again for the rest of your whole life. This is the bottom line. Otherwise, I mean, if a patient, you are not able to help the patient when he's in a real need of it, he would never even come to see you. Forget it. So this is something which is do's and don'ts, right? Friends, can I have your feedback quickly? Am I reachable? Am I clear? Am I not clear? Little bit feedback, please, so that it will help me to evaluate better, so that we can go to the next. Yes, thank you, Dr. Shreya. Thank you, Dr. Bansi. Thank you, Dr. Navneet. Great. If you have questions, then we can discuss it out afterwards. Thank you, Dr. Bisma. Super.